Pain symptoms are result of a stimulation of pain nerves. As I told you, while in hypoxia, cells grow in size, called edema. When edema grows enough to touch the adjacent pain nerve, the nerve is stimulated and you feel the pain symptoms. Meanwhile, there is a literature asserting lactic acid may cause pain symptoms as well. Coincidentally, lactic acid is a major metabolite of sugar under hypoxia. In any case, eliminating the hypoxia presumably cures many pain symptoms. It is different in nature from the painkiller pill, which merely relieves the pain symptoms temporarily. To eliminate the hypoxia, the first job is to improve RBC quality, the method I have explained in previous sections by the name of OTEC. If a microcirculation disturbance is out there, in addition, you have to utilize the vasodilating agents like ginkgo leaf extract. Attention, the serving size of X-Softgel, which is responsible for improving RBC flexibility, should be significantly increased while treating microcirculation disturbance. To be specific, 6 times the usual serving size. As I observed in the past, this method is very effective, but one point must be emphasized. Under hypoxia, original form of tissues change by the form of edema at the beginning. If oxygen delivery is increased by means of improving RBC quality, the edema disappears. In a sense, the tissues recover from enlarged size to original size. In other words, tissues live away from the adjacent nerve endings, and the symptoms disappear accordingly. This is, in effect, a cure. However, under long-term hypoxia, tissues, instead of enlargement as in edema, it shrinks. If oxygen delivery is increased, the tissues recover because of intrinsic self-repairing capability. Tissues recover in their size as well, from shrunken size to original size, which is, in a sense, enlargement of the tissue, inevitably pushing away the adjacent nerve endings in the path, so as to touch off pain symptoms. This is called healing crisis. This phenomenon is applicable to many chronic diseases that have anything to do with the shrunken tissues, not restricted only to pain symptoms. Mind you, recovery of some long-term chronic diseases is inevitably preceded by the recovery of shrunken forms of tissues, which induces temporary symptoms called healing crisis. Okay, let's move on to the next section, hypoxia on hypertension.